Hi, today we're going to talk about vaginas. Vagina is the female organ that changes as we age. We're born with vaginas and they're usually sterile when we're born. And then they change. They change as we grow, as we start producing hormones. They change, the shape of the vagina changes. The amount of bacteria and yeast that normally live there also changes. And as soon as you start having sex, that change even shifts more. So you have normally bacteria and yeast infection normally living in the vaginal flora as a normal vaginal flora. And depends on the changes in your pH, that harmony, that balance may change and may create symptoms. Symptoms of bacterial infection, symptoms of yeast infection, symptoms of dermatitis and irritation and so forth.
What circumstances can lead to infections in the vagina?
When you get to the menopause, same changes happen again, and your vagina become more prone to have all these bacterial and vaginal infections. You're also prone to have urinary tract infection because estrogen that you're losing as you age, especially when you're entering menopause, estrogen helps as a prevention, as a barrier that protects you from all these intruders. Once that estrogen is gone, the membrane is weak. This is what create the environment for bacteria and yeast.
Can the type of lingerie contribute to this?
Your underwear plays a major role also. What kind of underwear you wear? Is it cotton underwear or is it thongs? So most of the time, younger girls who wear don't wear cotton underwear, most of the time when they wear thongs, they actually mechanically disrupt the same membrane, protective membrane that helps to prevent that yeast infection and vaginal infection. So that also opens up the gate for bacteria and yeast infection and creates problems like contact dermatitis, fungal infection on the skin, and so forth. Use of antibiotics, especially excessive use of antibiotics, especially penicillin family, also creates environment that promotes growth of yeast infection in your body.
Can feminine products help against infection?
Sometimes women have discharge and they assume that they have yeast infection or bacterial infection, most of the time yeast. They go to the pharmacy, they get over-the-counter medication, use it vaginally with a suppository, so the creams, and sometimes they feel better, sometimes they don't, but what they do, they actually confusing the vaginal flora even worse. Your vagina has the mechanism of fixing itself. Vagina knows which bacteria is overgrowing and which yeast is overgrowing and has that mechanism to support and make it even. But once we start putting things in there, things like douching, things that the feminine products that they say good for you and sell over the counter, we actually confuse our vagina and sometimes we make it lazy. And that could be the beginning of chronic infection, chronic yeast infection, and chronic bacterial infection, which actually much harder to treat and much harder to control. So if you have vaginal discharge, yes, it could be yeast infection. Yes, it could be bacterial infection, but it also could be STD. How do you know? So that's why it's always better to go and have doctor's visit and have your cultures done and check and treat exactly what you have. Because if you have sexually transmitted disease like trichomonas, gonorrhea, chlamydia, it's not only you who has to be treated, it's your partner. So that's why it's very important to see a doctor and not just use over-the-counter medications.
How do women prevent infection?
During the summertime, the sweating is excessive. We go to the beach. We use pools full of chlorine. That increases the chances for fungal infection, irritation, and vaginitis and other problems. So in order to prevent that from happening, we need to make sure that you don't stay in a wet bathing suit for a long time. You don't wear tight jeans or shorts when you're at the beach. Try to avoid sweets, especially during summertime, because sweets are actually huge promoters of yeast growth in your body.
What foods promote yeast infection?
Anything between pasta, bread, it's not sweet, but it's carbohydrates, and anything between that and pastry, candy, that type of sweets. I'm not talking about sweets that coming from natural sugars like fruits, but natural sugars like honey, yes, it is a sweet that may promote yeast growth in your body.
What is the importance of pubic hair?
There is a debate about whether you have to use laser or shave or do nothing or do waxing in the areas of the perineum, which includes vulva, which includes area of the pubic hair and so forth. There's a lot of debates, and old school gynecologists, I remember, telling us that that hair prevents infection from entering into the vagina, so it's actually beneficial. But nowadays it's very prevalent for girls to shave it off or use wax. But whether you shave it or you use wax, there's always some changes on the skin, cracks on the skin, that increases the risk of creating infection, creating irritation, ingrown hair. Ingrown hair looks unsightly, number one, and number two, it's painful sometimes. You could be get infected, it could be painful on touch and sometimes uncomfortable to have sex and just even walk. Laser is the latest achievement that we have in terms of hair removal. It actually has a very good results on the skin, and even after the first treatment on your hair, you already see that there is a difference, that the hair grows slower, that it's much thinner, there is no ingrown hair, and the skin underneath is much smoother and silkier and looking much better.
What is defined as healthy vagina?
Is the vulva or vagina that doesn't bother you in terms of doesn't have any irritation, doesn't have any excessive wetness, doesn't have any smell to it. This is healthy vulva look. If you don't have any rashes, if you don't have any kind of ulcers that bother you, even ulcers that didn't heal for longer than a month, you have to be assessed by a doctor, because that could be beginning of precancerous or cancerous cells. Very important. Vulvar cancer is very, very rare, but it can happen.
What are the reasons and options for women to have vaginal rejuvenation?
There are different ways of rejuvenating vagina, and there are different reasons why women go for that. Number one reason, usually women go because vaginal floor, pelvic floor muscles become floppy, become weaker, become more stretchy, again, because we don't have enough estrogen at that time, which keeps it young and vibrant. And number two, due to various effects. It could be gravity, it could be weight that was pressing on it, it would be childbearing, it could be pregnancy, smoking. All these factors change the muscle of the pelvic floor, thus vaginal floor, and making vagina more loose and less toned, I would say. So the best way to prevent that, of course, to do it when you're young. Do yoga, do certain exercises, prevent obesity. If you have vaginal birth, just make sure that if you had any kind of stitching and episiotomy, that it was sewed up properly. That's very important. As you age, if you feel that it's getting worse and you feel that you need help, then there are certain surgeries, there are certain techniques that could be used. You could use topical estrogen and Kegel exercises, including certain devices, we call it vaginal dilators, for Kegel exercise that also help to tone the muscles of the vagina. This is a healthy approach. Another approach is rejuvenation by using surgical techniques, by straightening the muscle. Sometimes we put mesh to create tightness in the vagina. Sometimes we just put the muscles together and make it shorter to make it more toned. There's different ways to create a toned vagina. But of course, it's always better to prevent that and do it when you're young.
What is defined as a healthy vagina?
It's the vulva or vagina that doesn't bother you in terms of doesn't have any irritation, doesn't have any excessive wetness, doesn't have any smell to it. This is healthy vulva look. If you don't have any rashes, if you don't have any kind of ulcers that bother you, even ulcers that didn't heal for longer than a month, you have to be assessed by a doctor, because that could be beginning of precancerous or cancerous cells. Very important. Vulvar cancer is very, very rare, but it can happen.
Why do some women have enlarged labia?
We come from two parts, maternal parts and paternal parts. And that's why we have two ears, we have two eyes, we're symmetrical. We have two pieces of two parts. And once we fuse two parts, certain of them are coming from male. We do have X and X. One X is coming from mother, one X is coming from father. These are two chromosomes. So the one that's coming from father is actually breeding that part of the skin called scrotum, which holds testicles in a male anatomy. But anatomically, some people have much bigger skin because of that, and that's why some girls end up having bigger. And actually, in some cases, you could have symmetrical enlargement, and in some cases, you could see asymmetrical. So one side, which came from maternal side, is absolutely normal, and the second part of the vulva and labia is much more bigger than the other side. Once they get older, it actually can get worse, and discomfort will get even worse, especially if they gain weight. As they get older, it gets worse and worse, and then they have to do it anyway. But imagine if you're doing it at the age of 25, when the healing properties of your body is much better compared to the healing properties when you're almost menopausal or menopausal. The healing is completely different.
What are the options to fix this?
We do get patients who come in and ask for reduction of labial reduction to decrease the size of the labia. And you would think that it's just a cosmetic problem. But if you really start digging more and asking more patients, you'll find out that it's actually a physical problem that creates pain during intercourse, discomfort when they walk, when they try to do some kind of physical activity, when they go to gym, they can't bike. It is very, very difficult. They can't wear certain jeans, they can't wear certain clothes. They're very aware of that. And because of the physical discomfort, they become mentally aware. That creates psychological discomfort. And here comes the whole vicious cycle of huge problem, which a lot of times girls are very, very shy to talk. But there's help. There's a surgical help. Yes, it is surgery. If it's really affecting your life, you shouldn't be shy about that. You need to read it. You need to talk about this. You can come in, we could talk. But this is something that could be fixed. It could be fixed surgically. But it's only if it's affecting your life.
What would be the best way that all women can take care of their vagina?
Seriously, the best way to take care of your vagina is actually the less you interact and the less things you put in there, meaning that all these feminine products, douching, things that advertise and say it's good for you, not always good for you. So it's better, the less things you put in the vagina, the better. And you don't have to be paranoid about your vagina and looking down there all the time, but you have to be aware. You have to know how does it look, you have to know how does it feel, you have to know if it has any moles in there on the vulva, if it has any kind of lesions that you haven't had before, and all of a sudden you feel a bump. Why don't you come in and see a doctor? Because it could be sexually transmitted disease, it could be condyloma, which is genital wart, it could be herpes, it could be anything. So you have to be aware of the vagina and keep it healthy. You have to wear cotton underwear, use very mild soaps. You have to know your partner, of course. And if you don't know your partner, always use a condom. And if you're allergic to condoms, then unfortunately, there's a latex-free condoms, but they do not prevent sexually transmitted diseases. They're not allergenic, but they do not prevent sexually transmitted diseases. They only prevent pregnancy. So you have to consider all these facts, especially the sexual partner. You have to know your sexual partner. You want to be in a relationship when you know that you're the only one with the sexual partner, because the more sexual partners your partner has, the more chances for you to get all the problems, including STD and including HPV, which is sexually transmitted virus, which can cause cervical cancer.